first kind is lymphadenitis. Different terminologies that I've given you examples of when the different terms, like lymphadenitis means it is a swollen, painful node which is responding to a foreign body or infection in the body. So that means lymphadenitis is nothing but related to your lymph nodes, swelling of the lymph nodes. Lymphadenopathy is nothing but a collective term for the lymph node diseases. So any sort of diseases affecting the lymph node is called as a lymphadenopathy. Lymphangitis is nothing but inflammation of the lymph vessels. Lymphedema means the term itself is telling edema, so it's nothing but swelling of the tissues caused because of some kind of a blockage of the lymphatic vessels. And lymphoma, so oma is again related to some sort of a tumor or abnormal growth, and yes, it can be benign or malignant. So this is again associated with the lymph nodes as well. So that terminology is called as lymphoma. Now in that again we have the two types, which is called as Hodgkin's disease and non-Hodgkin's disease, or it's called as Hodgkin's lymphoma and non-Hodgkin's lymphoma. So the first one, that is Hodgkin's lymphoma, is a cancer of the lymphatic system. And what happens here is it can start from anywhere in the body, and the causes for this may be due to any sort of infections like HIV, Epstein-Barr syndrome. It can also be from due to age or a family history. Some of the symptoms that is associated with this particular disease will include like a severe weight gain, fever, swelling of the lymph nodes, severe sweating at the night times, itchy skin, weakness, fatigue. The patient may also be complaining of severe chest pain, terrible cough, and also there will be trouble when the patient is swallowing as well. Now all this is because of there is some kind of a growth, and as we told, when you say lymphoma, it's nothing but some kind of a tumor or an abnormal growth which is obstructing especially if we say there is trouble swallowing, is there something obstructing there, and that's the reason why the patient is feeling that problem for swallowing as well. And the non-Hodgkin's lymphoma is nothing but is usually a malignant cancer. So yes, it is progressed and the disease is going to be a malignant cancer. So benign, the two types is, and the cancer is benign and malignant. So benign is just which is not very serious, but when you say malignant, yes, it is a malignancy, means yes, it's a serious condition in a very simple terminology to explain it to you. And it is also caused, why? Because the body may be producing too many abnormal white blood cells, and it is not the same as Hodgkin's disease. And here again the symptoms will include it may be some kind of swelling of the lymph nodes in the neck area, so the cervical area. There would be weakness, fatigue, fever, weight loss, as well as severe anemia as well. And at times, yes, this condition can be painless as well. So some may complain of pain, but yes, most of the time it could be painless. Now lymphadenitis, coming to the topic for today, is infection of the lymph nodes, which is caused usually by any sort of a microbes or a microorganism like a bacteria, virus, or a fungi. And the symptoms include like swelling around the lymph nodes. So this is what you see in the picture here. When we mention about the neck area, you can see the lymph nodes, and I'm sure you would have noticed this even when when anybody would have had any sort of infection. There is some kind of swelling of the lymph nodes. When you feel it, when you touch it or feel it, you can see there is some kind of a bulge. It also can appear in the groin area, and sometimes this can become very, very painful to touch as well. So this indicates there's an infection, and that is why this kind of swelling occurs. So this is what you see in the picture here, that it is a swollen and an inflamed lymph node. So yes, there is swelling, it is tended to touch, and that is why it is marked as red. And in a healthy individual, when there is no disease, and that is how it looks, the neck area which says healthy lymph nodes are not visible. But when there is an infection or an inflammation, you will see that these lymph nodes will actually begin to swell up, and it can be actually visible with a kind of swelling and redness. And lymphangitis is nothing but inflammation of the lymph vessels. So you can see this kind of redness, and because you know that I'm sure you will learn this in your anatomy, that how the lymphatic system, it is spread all through your body. So it can occur anywhere. So any sort of infection or inflammation affecting the lymph vessels, and this is what is the signs and symptoms you will see. Okay, that there will be redness, there will be swelling, there can be a slight sore. It can be painful, and also there can be red marks in the body, like it is streaking, like you can see on this patient's arm, and also the armpit area, it is red, and the affected area can appear to be red, and also there can be pain. Now lymphedema, so I'm just introducing you to the different terminologies here, and I'm showing you pictures about what they look like. And lymphedema is nothing but, you can see the differences here from what it begins as, then how it progresses, and what it ends up to be. Okay, so lymphedema, what happens here is there is chronic pooling or collection of this lymphatic fluid in the tissues. Okay, so you know that the lymphatic system, there is the lymph or the fluid, and what happens with that, if there is a collection or a clogging of that particular fluid in the particular area of the tissue, then that becomes like a swelling, and this usually begins in the feet and lower legs. And how does it affect and how does it proceed? So in stage 1, you can notice the difference in the legs. So the right seems to be normal, but whereas on the left leg you can see, yes, there is severe swelling, and that is a beginning stage. So you can see some sort of a thing. And in the second stage you will see that, yes, there is some kind of discoloration and the swelling has increased. And third, again, you see that, yes, there is drastic swelling towards the lower limbs, and you can see how the ankle area as well. So you can see how swollen the legs have become, and finally it can end up as this, and this, in the common term, it is called as elephantiasis. Okay, and this is the lower limbs, how it is affected, and the similar thing you will see in the upper limbs as well. So the first picture here, almost what is that, stage 1, yes, it looks it looks normal, but yes, there is a slight abnormality in the left arm. Eventually you can see the swelling, and you can see how the fingertips have begin to show the discoloration. And similarly in the third stage, it's increasing, and even the swelling is also seen on the outer portion of the palm and also the fingers. And the last stage, which is very critical, or the complicated stage, you can see that how much of swelling, and that means all this is accumulation of this particular lymph, when it has literally drained out into the tissue layer as well. Now, what the meaning of lymphocytosis means, that is nothing but a high lymphocyte count. Okay, so when you do your blood test, that is when you will realize these things, because you will know the blood count as well. So when you do the complete blood profile, you will know that if there is any kind of increase in the lymphocytic count, then that particular terminology is called as lymphocytosis. And why is it caused? Basically, you know that yes, in the lymphatic system, again, it's something like the defense mechanism, so it's trying to fight infection, and it helps to purify and filter. And what happens here is, when there is an infection, okay, the blood cancer, lymphoma, or any sort of autoimmune disorders are accompanied by this particular chronic, any sort of chronic diseases or conditions. And lymphocytosis, so you can see that in the normal individual how much it is, and even when there is an increase in the count, then that is particular is called in the lymphocyte count, and that is called as the lymphocytosis. So that means an abnormal or above the normal range of lymphocytes. And the causes here is again given to you in detail here, because it can be any disease of the lymphatic system. Even during the menstruation times, it can occur in case of hepatitis, a severe viral infection, and even sometimes it also occurs due to some kind of hard work, like physical activity is being performed. Yes, this kind of a condition can occur again, leading to some sort of an infection. Acute infectious diseases like chickenpox, rubella, whooping cough, or any other kind of diseases as well can contribute to this particular condition. Tuberculosis, as well as rheumatic diseases. So coming to the topic, lymphadenitis. So this is what I was telling you in your anatomy session. You would have learned about what is the lymphatic system, and the green portion here is what is actually showing you your lymphatic system, the lymph channels, and all the bulging little nodes that you see are nothing but your lymph nodes. Okay, and yes, you can see the thymus here, from where it is produced, the bone marrow, the spleen, and the lymphatic system. And the normal will look like, the lymph nodes will look like this, but you can see the swelling or the swollen lymph nodes, how they appear to be. And this is what I said, it can turn out to be very nodes. Okay, so you can see this, and there is redness and swelling of the particular node. Sometimes you can also see, as I told you, the lymphatic system runs all through your system, and this kind of swollen of the lymph nodes or swelling of the lymph nodes can also be seen in your mesentery, in your abdominal area, and this is called as mesenteric lymphadenitis. Okay? And as I told you, this can even turn out to be cancerous situation or condition as well, which is a TB lymphadenitis. Again, it's a tuberculosis. So again, you can see how the swelling of the neck is there, and sometimes what happens is these nodes can be painless, okay, and it is non-tender, and sometimes they end up in having an sometimes, very rarely, like they ulcerate, and they may have to have a discharge as well. Like they start to show some kind of a drainage as well. So this is nothing but TB lymphadenitis. What are the causes for this particular condition? Yes, the most common cause would be streptococcal infections affecting the throat, any sort of infectious diseases, as we mentioned about chickenpox, measles, ear infections, Even if you have an infectious, oral cavity like a tooth abscess, skin and wound infections, as we just discussed in the previous session, the cellulitis can also be one of the most important cause. Also, it can be due to any sort of viral infections or a fungal infection as well. And some of the other infections will also include tuberculosis, some kind of sexually transmitted diseases, also a parasitic infection, and even something called as cat scratch fever. That is an infection or a bacterial infection that a person develops when they get a scratch or a bite from an animal. So that is also leading to some kind of infection in your system. So these are all the important causes for this particular. Even the immune system disorders, like especially when you're immunocompromised and when your immunity levels are really low, yes, this kind of disease can also affect your body in different ways. It can target your joints, the skin, kidneys, blood vessels, heart, as well as the lungs. And rheumatoid arthritis is nothing but a chronic inflammatory disease, and this is nothing but a disease that is affecting the tissues that line your joints. Okay, so that means when something like this occurs, that can be very, very painful, redness and swelling, and the patient will not be in a position to carry out his normal physical activities as well. And we also mentioned that yes, when there is a malignancy, having a growth or an abnormal tissue growth, so that's resulting in either benign or a malignant condition. As if it is diagnosed in the initial stages, yes, the complications can be prevented. If not, yes, it can result in a malignancy and called as lymphoma. There's nothing but a cancer that arises or originates in your lymphatic system. And leukemia is nothing but the cancer of the body's blood-forming tissue, and also other cancers that can spread or metastasize, which means in any other portion of your body you have a malignancy or an abnormal growth, and that particular infection can metastasize, means it can spread and affect your lymph nodes. So this can also be the factors. Now, coming to the clinical manifestations, so when a person is having this particular condition, what he would be experiencing. So yes, there's going to be severe tenderness, swelling, pain, and you will also the patient will begin to see like there is a swelling in the size of a pea size, okay, like the green peas that you have. So a pea size projection or a swelling or a bump will be seen, and again, maybe especially when you say that it's an infection, the patient may usually start off with a runny nose or a sore throat, fever, and also an upper respiratory tract infection. Okay. There can also be some of the general signs and symptoms, and also, as we mentioned, this kind of lymph node swelling can occur anywhere in the body. So most commonly seen in your neck area, in the groin area, or anywhere. And sometimes when you see this on palpation, it's going to be severely painful as well. Okay. And yes, when you record the temperature, that's going to be a fever, and as you mentioned, severe sweating at night. So these are some of the common signs that is exhibited by the patients. Now, how do we diagnose this particular condition? So a thorough physical examination and a medical history is very important and crucial, and depending upon your condition, like getting history about your infections, your infection rates, how often you get this fever, runny nose, all that has to be checked. Even a pathological investigation, which will also include a detailed blood profile or a blood investigation, has to be done, confirming your complete blood count and also your lymphocyte count. Everything has to be done in detail and checked and assessed, and also sometimes a chest x-ray is also would be advised, or even a CT scan can be told. And in case of a malignancy, especially when you know that there is a growth, then it's better we do a biopsy. So it is nothing but you're taking a sample of the tissue and you're setting it for the test, and just to confirm that yes, there is no kind of abnormal growth or malignant. So the treatment for this condition would include, yes, we know it is a bacterial infection, so yes, definitely antibiotics to treat the particular condition. And as we mentioned, any infection does not mean antibiotics, so the infection itself has to be ruled out, whether it is bacterial, viral, fungal, or parasitic, and depending on that, the management would start. And once the doctors have prescribed a particular management therapy, then it has to be followed thoroughly for that fixed number of days. Checking your immune system or the lymph nodes and checking the condition Also, especially when the patient's body is immunocompromised, so that's another important problem, because yes, the body is not able to fight, and the infections can become more, and it can lead to further complications. Especially in terms of malignancies, there should be thorough screening and diagnosis, and prevention, or the management has to start from the initial stages itself, and especially talking to the patient and the family members regarding that, explaining to them in detail what the condition is, and in case if there is a radiation therapy required or chemotherapy required, it has to be discussed with the family and then decided, and the treatment has to be started as soon as possible, and need be surgery can be performed as well, where there is any kind of the abnormal growth, as we mentioned, if it can be removed, then that is another good thing, so that the disease does not progress or metastasize to the other parts of the. And the lifestyle and remedies of prevention will include that, yes, for the minimal complications or the minimal conditions, yes, when it starts off as fever, swelling, pain, and tenderness, then yes, applying warm compress that will take care of the pain, and the swelling can also be reduced, and over-the-counter medications, yes, if you have, but it's always better to consult, and if the doctor has given you some analgesics, then stick to that, have your analgesics, and also or anti-inflammatory medications like ibuprofen, Advil, and all this will take care of the inflammation, aspirin, and also once the infection is being ruled out that it is it's bacterial, then yes, you will be prescribed antibiotics. So very important, you take your antibiotic course of medications. When you come back home, then adequate rest, fluids is also very, very important. So with that, we finish this topic. Thank you for your time.